Good afternoon. It's nice to be with you again. Today, I want to provide you with an update on the data reporting issue I brought to your attention earlier this week. It's a problem the governor demanded my team and I solve. Addressing this has been our top priority and our focus over the last 72 hours. I want to explain to you what went wrong and its effects. Here are the bottom lines. Number one, our data system failed, and that failure led to inaccurate case numbers and case positivity rates. It also prevented counties from having some of the data they need to monitor and respond to the virus in their communities. Number two, no changes to our response policies were based on the incomplete data. Number three, we believe the trends we discussed earlier this week remain the same. Case rates continue to follow the trend we see in hospitalizations, showing slight decreases. So how did this happen? On July 25th, a server outage created a delay in lab records coming into our lab reporting system. As a result, we instituted technical changes that allowed the records to flow into the system more quickly. These technical changes were supposed to be temporary. However, they were not later disabled, causing further delays in our reporting of lab data and creating an extensive backlog. Simultaneously, we discovered that we were not receiving data from one of our largest commercial labs for a period of 5 days between July 31 and August 4th. This was due to a certificate that the state neglected to renew timely, which resulted in data not being able to transmit to the state. Throughout the pandemic, the CalReady data reporting system has been challenged by the volume of COVID-19 data, and short delays are not uncommon. I became aware of the magnitude of the data backlog in the late afternoon on Monday and alerted the governor and his senior staff shortly thereafter. So how are we addressing this? Simply put, the CalReady system was not built for this volume of data. In order to create a lasting solution, we are accelerating the development of a new laboratory reporting system for COVID-19. In the short term, we have reversed the technical changes we made last month that were supposed to be temporary, and we renewed the certificate. We are putting in place new protocols and notifications when any system changes are made. We are making upgrades to our servers to ensure that we have extra capacity. And we now have a redundant system to validate the data and reports. We strengthened oversight and monitoring so case data are complete, timely, and validated. And finally, the governor has directed a full investigation of what happened, and we will hold people accountable. So where are we now? Over the last 24 hours, we have seen a normalization of the flow of data coming into our lab reporting system. We expect that over the next 24 to 48 hours, that the backlog that is between 250,000 and 300,000 records will be resolved, giving us a better sense of the total number of tests that were delayed. We are reporting these tests to the counties based on the date the specimen was collected, so we can attribute it to the appropriate day. We apologize. You deserve better. The governor demands better of us, and we are committed to doing better. Now, I'm happy to take any questions you may have.
Karen Luna, the Los Angeles Times.
It appears that some locals were told about this as early as last Friday. So why did the governor highlight a 21% decline in confirmed cases on Monday?
As I said, we learned of the issue Monday afternoon after the earlier press conference where the governor unveiled some of the changes in cases and test positivity. And we immediately began conversations with our local partners about some of those test data reporting issues. And Tuesday, I began to notify the public about those challenges and have since been working on it.
David Baker, Bloomberg
two things. One, are you satisfied that the problems with the data go back no farther than July 25th? And two, when you say 250,000 to 300,000 records are backlogged, does that mean 250,000 to 300,000 case results or test results?
Yeah, thank you. Both important questions. We believe after extensive look at pretty far back, not just all of the last month, but even into the prior month, that the root cause of this problem and challenge started on the 25th of July. When we look, and I mentioned 250 to 300,000 records, I appreciate a chance to clarify, those are records. We often receive records, sometimes they're duplicate records, and there's a deduplication function that allows us to make sure that we only have unique records. And those are test results. We don't yet know how many of those are positive or how many are negative. And in fact, this entire CalReady system accepts results not just for COVID, but for other reportable diseases. So all of those records are the total number of records that need to be sorted through. And so we won't yet know until 24, 48 hours from now, once that entire load is worked through, how many are COVID related and how many of those are positive versus negative tests.
Jody Lebec, Los Angeles Blade.
Dr. Ghaly, good afternoon. I'm going to follow up his question and I have a separate one. Looking at that data, exactly how far skewed are the results from the 25th of July, or is it going to take a period of time for you folks to work that out? The second part of my question, there's been a growing number of homeless people in Los Angeles County who have hanged themselves. In fact, in 2016, 40% of the suicides were by hanging. According to a Los Angeles Times analysis, that figure shot up to 55%. My question to you is, has the state increased its efforts, especially in mental health preparedness for Californians who are homeless that are dealing with challenges and now the COVID on top of it, and maybe even homelessness caused by COVID? This is particularly critical since so many of them are now not going to have access to the internet or even access to the COVID site. And, you know, obviously for the LGBTQI community, there's a disproportionate amount of them that are young people who are LGBTQ.
Sure, thank you for the questions. On the second question, we continue to work with our local partners on increasing and strengthening mental health and behavioral health resources, broadly speaking. We know that the COVID pandemic, both the risk and concern around being infected, and even additionally, the changes to how our daily lives are led create challenges for all populations, and in particular, individuals experiencing homelessness. So we work with our counties. I know Los Angeles County Department of Mental Health, Public Health, and the entire county family is working hard with local partners to increase the availability of those services and to ensure that any trends of increase in suicide, hangings are addressed through not just direct services, but other policy considerations and looking at any additional funding or resources that can go to address those concerns.
Sophia Bolo, the Sacramento Bee.
Hi, Dr. Ghaly. I'm wondering if you can clarify. So at this point, is the problem fixed? And can you give us an estimate on how quickly you think you guys are going to be able to get rid of that backlog you described? And then sort of related to that, it sounds like, you know, you guys have put fixes in place, so moving forward, the numbers are going to be accurate. Can you explain why it's then still necessary to build a new system?
So I'll answer your last question first. CalReady has been built, and I mean, many jurisdictions have lab reporting systems and frankly, public health data systems that you know, have been working for a number of different diseases throughout the last many years and decades. COVID-19 certainly as a large pandemic where we're not only reporting hundreds of tests, hundreds of thousands of tests, frankly, not just the positives, but the negatives, really it requires us to build a type of system that will certainly hold all of that information and continue to serve the function that we need. We have been able to use CalReady adequately. We have had some delays in the past and been able to address those delays with both some IT fixes as well as some other programmatic changes. But we feel that at this point, given the importance, the ongoing importance of having the data be timely and accurate and complete, that we're electing to, in parallel to right now, create that new system so we have it at the ready. As far as the time that it's going to take for us to work down the backlog, as I mentioned, we are doing that actively now. We believe it will take anywhere from 24 to 48 hours to work through the backlog. I'll remind you that once we do work through that backlog, there's still an important function that the counties must do to verify those positive labs and to attach all of the demographic information that we've been talking about. With many of you, race, ethnicity, sexual orientation, gender identity, tying it exactly to the county and the area of record. So it does take a little bit more time before that gets reported as a positive test on, let's say, the state's dashboard. So we look forward over the next 48 hours, 24 to 48 hours to work down that backlog, support our counties in making sure that the work that they need to do can be done timely so that we can report any new positive tests. Then we can understand a little better our total statewide epidemiological curves, understand when and where these positive tests belong over the past couple of weeks, so we can not only do improved contact tracing at the local level, but we can understand what the future state of hospitalizations will be. Because I'll remind you again, hospitalizations lags test results, and those test results in cases allow us to understand what's to come in our hospitals.
Janie Har, the Associated Press.
Hi, Dr. Ghaly. Counties have been telling us that they notified the state of the problem with CalReady, in July. And since then, the state has continued to make decisions about businesses and school reopenings, and you've added counties to the monitoring list and updated the transmission rate data daily. Why did it take a week or so, or 2 weeks, or whatever, for it to come to your attention? And how much confidence should the public have in the decisions that the state has made in that time?
Yeah, I mean, all very excellent questions. We are currently working to understand the sort of communication of this issue within our organization, both the Agency of Health and Human Services as well as the California Department of Public Health. We are aware that individuals there were knowledgeable of some of these challenges, and we are doing a complete look into how that communication both could have been better and where it went wrong. We know that the data has been an important tool of our decision making. We know that our data-driven approach has been foundational, and that we expect, now that we have made some of the changes and we've increased our confidence now with additional redundancies to look at the data more closely, additional individuals and teams to make sure that it's timely and complete, that that confidence will continue. As far as it refers to the county data monitoring list, we did not, over the period of the last many days, use the data in the data monitoring list to create any closures or any policy decisions. We, in fact, froze the data monitoring list on Friday, actually as a result of a different reason. We were looking at ensuring that the hospital data that we knew had transitioned from our local state data reporting metrics to the national federal reporting metrics. So we froze them in order to make sure that we were inputting that data adequately. So since Friday, all counties have been sort of paused or frozen with the county data monitoring list. And as we increase our comfort in the confidence with the numbers now, and we work the backlog that we just finished speaking about, we will unfreeze the data monitoring list and allow counties to pick up right where they left off. So we're taking that into account and certainly considering how, if in any way, this issue affects our policy decision-making and impacts any counties as it refers to opening or modifications of any of the sectors that they're interested in.
Patrick Ghaly, ABC4 News, Los Angeles.
Thank you very much, Dr. Ghaly. I'm curious how great your concern level with these 250,000 cases that they are too late now to contact trace, and that perhaps we may have more spread because we haven't been able to trace those cases. And secondly, a tangential question, if you would, do you have any concern with the increasing use of self-administered COVID tests, that maybe the public is not that good at gathering samples and maybe we're missing a lot of positives? Thank you.
Yeah, I mean, both excellent questions. First and foremost, we've been in the middle of this dealing with reporting delays from labs, turnaround time challenges. So together, yes, we want to be certain to get these lab results back to the counties as quickly as possible so that contact tracing work can begin. We know that some of the labs resulted today, in fact, were collected 2 weeks ago, and it's just slow turnaround time compounded with some of the reporting challenges that we just discussed. And that's why it's an urgent issue for us to not only work down the backlog, but to get the results in the hands of the counties and provide support where we can to make sure contact tracing can occur timely. We are not sure the extent that this delay will impact contact tracing, but at this point we are working hard to make sure no further impacts do occur. As in regards to self-administered tests, I think we all have concerns. I think that what we know are that people who are symptomatic and having even more extreme or moderate symptoms, that they're more likely to have a positive test. They're the ones usually getting tested in clinics and emergency rooms and hospitals. Those who are doing the self-administered test might be mildly symptomatic or asymptomatic and just been exposed. And for them, it's absolutely important and imperative that they follow the instructions that come with the self-administered tests and do it and be really thoughtful as they administer the test, because absolutely the way the test is administered may impact the result. And I think what we do know is that people who test initially, if they get a negative test and they develop symptoms, they will then be able to go to a clinic or an emergency room and get tested if their symptoms become so severe. So, you know, self-administered tests in many ways, they do have some concerns, but I think as a part of our testing continuum and the ability to get tests to people quickly, they're an important part of what will continue to develop and evolve.
Dustin Gardner, the San Francisco Chronicle.
Hi, thank you. You mentioned a certification issue with a large commercial lab. Can you specify which lab that is and what type of certification they failed to renew and how often that certification is renewed?
Yeah, great question. So to get into the weeds a little bit, there's a lab reporting intermediary that functions across the nation for certain labs. The lab that is a strong partner of ours, Quest, they send their lab results to this intermediary that has a certificate process. And because of that certificate, it then routes the Quest labs directly to our lab reporting system. The challenge was that the certificate expired at the end of last month, and for a series of four to 5 days, that certificate was not renewed. It required the state to take action, California Department of Public Health, to take action with that intermediary to renew the certificate. As soon as it was renewed, the Quest labs began to flow in back into the state reporting system. That certificate, I believe, is renewed every 2 years. And so this was when it expired, and now it's been renewed.
Thomas Fuller, the New York Times.
Hi, Dr. Ghaly. This is just 3 quick questions. Just doing a little simple math, 300,000 cases, potential COVID cases, at a 6% positivity rate would be 18,000 positive cases. So can we say that at most there were 18,000 cases, positive cases that were not reported? Second, just want to make sure that this only, that the breakdown in the system only affected cases and not hospitalizations and deaths. And then third, can you give us a follow-up to the governor's assessment on Monday? Can you tell us if you think the COVID situation has stabilized, is declining, or otherwise, given what you know right now?
Sure, all 3 excellent questions. The first one I'll answer, so just to spend a little bit of time, 250,000 to 300 distinct records. We know that those are not all COVID records because the CalReady system invites all records for all reportable lab tests to the state. A majority of those we know are going to be for COVID-19. I'll remind you that some of those records, because labs sometimes out of an abundance of caution send the same data file twice. So the first thing that needs to happen are any duplicate records have to be reduced down to just a single unique record. So that will happen and reduce that 300,000 potential number down. And then those will be divided up into the positives and the negatives. So although your good, quick math exercise could hold true, we will see, frankly, by the number of unique records, how many are for COVID and not something else, and then we'll be able to apply a positivity rate. And that's what I look forward to learning over the next 24 to 48 hours. And as soon as we do, we're going to let the public know. With regards to your third question, I'm going to remember your second one in just a moment. With regards to your third question, we do feel confident in the trend. We've been looking at today's number, validating it, doing similar sort of calculations as you went through, and believe that the trend has been stabilizing and coming down. In regards to your second question, the hospital and death data is absolutely collected in a different manner. The data is reported to us differently, and we have the benefit of being able to call our 416 hospital partners across the state and reality check with them. Are you seeing the actual decreases that we're seeing in the data within the wards of your hospitals, within your ICUs? And overall, what we know is many of the areas where we've seen that decrease validated by our hospital partners. And as we said, there are parts of California that are still experiencing an increase, and we see that as well. So that data, rest assured, we feel good about, and we've seen these decreasing trends in hospitalizations over the last couple of weeks, and those will then lead to what we expect are reduced numbers of deaths in the coming weeks as well.
Daniel Borenstein, the San Jose Mercury News.
Doctor, thank you. Can you help me out understand a couple of things? Santa Clara County, first question, Santa Clara County says the problem is running reporting data back to July 16th. The second thing is, exactly when do we expect that we'll be able to see accurate numbers of cases and positivity, including going back, so that we can see what has happened over the and see an accurate trend line? And third, how can you be confident the data trends are as stated on Monday when you don't have the accurate data and especially the positivity rate?
Sure. Thanks for all those questions. So on your first question regarding earlier in July, as I said, we have periodic CalReady and data reporting system delays, slowdowns. They are often temporary in nature, lasting a short period of time, and then things normalize. What happened on July 25th persisted for a longer period of time, and as a result, we had a more significant delay, led to some underreporting day over day, and really led to some of the backup that we're seeing. With regards to how we will report out those tests, we will absolutely do what is the appropriate epidemiological thing to do, which is not just attribute the test to the date that we received the test or even the date that it was resulted, but actually take it and attribute it to the day that the test was collected. We call that the episode date, and that gives us the most accurate sense of when somebody in our community was positive. And then in regards to your third question on our level of confidence, we are constantly looking at the data after developing confidence in the ability to capture all of the data and looking at these numbers. Even, for example, today, day over day, we are seeing, although the underlying numbers are different, we believe the trends in fact hold, and we'll be validating that over the next 24 to 48 hours, and especially as we get the fully completed data reports from the counties after they do the bit of work that they need to do with each case.
Spencer Custodian, Voice of OC.
Hi, thanks for taking our questions, Dr. Ghaly. Mine is on the schools. There's been a host of schools, especially in Orange County, last count over 100, a mix of public and private charter schools, but they've all applied for the waiver process. And now with the reporting backlog with the testing results, has this process been put on hold, or is there any kind of plan to slow that down, or maybe just put it off altogether for a week or two?
Yeah, excellent question. As I mentioned, the county data monitoring list was frozen last Friday. We will only unfreeze it after we have the confidence in all of our data. It's not just accuracy, but completeness. Give us a chance to work with the counties to update what those data numbers look like. And then if counties can proceed with the waiver process, they will be allowed to. We are not putting some time delay on that process now, because we know around the urgency of planning and the questions many parents, teachers, school administrators have around this process, that we look forward to really resuming that once the county data monitoring list is unfrozen, so that our local communities like Orange County can make decisions based on the guidelines of that waiver and the local conditions and decisions.
Final question, Aaron Mento, KPBS.
Yeah, hi, Dr. Ghaly. My question is similar to some early ones, but I'm still not clear on it, so I want to ask in a different way. Sure. San Diego County is on the monitoring list, and our case rate has been going down and getting us closer to coming off, but it's reporting a slightly lower case rate than what the state is reporting for our region. And I'm actually not talking about what the state has posted on its county data website that currently says 134 for us, but you said that was frozen. The county is reporting on its own website a case rate that it calculated of 110, and then a case rate of 112 that it says was calculated with state data. So I'm trying to understand why the county and state case rates are still different, and which one you're going to follow to determine if we come off the monitoring list.
So whenever we have discrepancies in calculations and data, and we've done this with other counties, there is a process to meet and have a conversation. So earlier in the week, I myself was involved in a conversation with some of the San Diego leaders around some of the data reporting issues. Certainly this period of freezing the county data monitoring list and awaiting the backlog to be worked down is an important element of that. But we have planned conversations with San Diego County about the data to make sure that we not only agree on the number, agree on the metrics and how we calculate those, so those important decisions that you're talking about can be made with complete agreed on calculations and metrics. So with that, I just want to thank you all, your patience joining us on a Friday afternoon. We will continue to work over the weekend so that early next week you can report on the status of the backlog and what it meant in terms of cases and how it impacts the broader sense of transmission across the state. I hope you each have a safe and wonderful weekend, and I look forward to seeing you next week.